dialysis care in Cleveland, MOTAP. MOTAP stands for Minority Organ Tissue Transplant Education Program. Cleveland MOTAP has many programs, and I have the privilege to coordinate outreach events for Community Vaccination Education Program. The Community Vaccination Education Program is grant funded by the Centers for Disease Control Foundation and the Centers for Dialysis Care Foundation. The overall goal for Cleveland MOTAP's Community Vaccination Education Program is to increase confidence in COVID-19 and influenza vaccines in the targeted communities and getting more adults in the African American population protected against COVID-19 and influenza. For more information about Cleveland MOTAP, check us out online at clevelandmotep.org or like us and follow us on Facebook at Cleveland MOTAP. My direct contact number is 216-658-0727. Today we have podcast guest Yvonka Hall, who is the Executive Director of Northeast Ohio Black Health Coalition. Yvonka, can you tell us the important work that your organization does in our community, please?
First off, thank you for having me.
Absolutely.
The Northeast Ohio Black Health Coalition is the first coalition in the state of Ohio to focus exclusively on African American disparities by looking at racism, research and evaluation, policy, behavioral health and addiction, health promotion, and community engagement. And we do all of this work by working to educate, advocate for, and empower the community. So we look at education, employment, housing, and health, and all of those things that impact those structures. And then we work to make sure that we're empowering the community to come up with solutions.
Wow. Thank you for the important work that you do. And I know you go by your initials, NEOBHC.
Neo-Black.
Yes,
so
see, that makes it easy.
BHC is black. So.
Yes. Cleveland MOTAP is definitely honored to be a community partner with you, and our vaccine navigators definitely enjoyed getting out in the community and educating the community about vaccinations. So thank you for having us, when you have events. So let's jump into some of the podcast. This is going to be a conversation, and again, we thank you for taking the time out of your busy schedule to be here with us today. Over 2 years later, the COVID-19 pandemic is still here. Northeast Ohio Black Health Coalition what has the coalition been doing during the pandemic to get more people vaccinated and keeping our community safe?
Wow. So I think we have to start off with the community safe part first. Mm-hmm. So the community safe piece is as soon as we realized that we were going to shut down the schools, we reached out to see if there was going to be provisions for disabled students and their families. And when we found out that there were no provisions, what we did was, as a team, myself and 3 other ladies came together, and it was supposed to be 4 days of delivering lunches, breakfast and lunch, to students that were disabled and their caregivers, because more than likely, if a student is disabled, they're either with an elderly caregiver in kinship care situations, or they have a mom or dad that are working. So it's how do we make sure that we're getting provisions to young people so that their caregivers won't risk coming in contact with a virus, right?
Yes.
And so between March the 16th, 2020, and last year, we sent out 200,000 meals. We had 3 programs, Babies and Brunch, which focused on children that were in school. We had Meals for Mamas, which focused on families of children that weren't in school. And then we created a program called Delivering Hope, which was actually for people who are disabled but are not seniors. And so one of the things that we saw is that people who were disabled and not seniors, there were no provisions that were set aside for them either. because they weren't part of like the regular food distribution programs because they're not seniors. And it started because there was a young man who went to high school with me, who my brother said, Clyde is very ill. He's having some health challenges, and I don't think that they're eating. And I said, okay, well, we're going to put them on the list, and we're going to make sure that we deliver food for them. And so we did. We did it for 2 months. The third month, he died. And so those things, keeping the community safe was important for me. The other thing is that right away, members of my community started dying. And so it was, we want people to live. So how do we make sure that people have those other provisions? And that included wipes, masks, sanitizer, and we started passing out street level. Passing out not one mask, but we gave you masks, we gave you a 30-day supply. Because the other thing that was going on in our community is people were sharing masks because early on there were no mask distributions. The stores were selling them. They were very expensive. And so how do we get basic needs out to community members that need it most? And so for me, it's you go to where the people are. And so that's what we did. We sent out over 60,000 masks and counting, still sending them out. It's important for people to still mask up, back up, wash up, and roll up, which is our slogan around COVID vaccinations. And so those things were important to us. The other thing about the vaccinations is, testing. When testing first started, it was very hard, and still is very hard for our community members to get tests. But vaccinations, it was even harder because, we have this whole thing around access. And so we had, other community members saying, oh, we're going to set up this great place and it's going to be at the stadium and, it's community friendly. And it's like, do you understand where communities live? And so there's a difference between access and accessible. And so what we wanted to do is tap into that accessibility, take vaccinations to the people who needed them the most so that we can not only protect them, but protect their children. Because we know that the dangers of children in our community losing their family members to COVID was very high. And so when we looked back over it and saw that in the African American community, African American children were 2.4 times more likely to be orphaned as a direct result of COVID. And so we did everything in our power to make sure that statistic didn't impact people as much here.
I never looked at it from that perspective. Wow. And transportation, of course, being an issue. And then the vaccination piece, that kind of goes into my next question. First question and next question. People of color being at more risk of being affected by COVID-19 and with vaccination hesitancy in our community, the Black communities. What do we do to keep them safe and get vaccinated?
I think the first thing is we have to address racism and the impact of racism on how African Americans have been treated in our health and healthcare systems. That is a big part of that mis and disinformation that was so prevalent and is so prevalent in our communities. Early on when we started talking about COVID, there were these misnomers around Jamaican rum. If you drink Jamaican rum, you won't get COVID. And so all of a sudden we had all of these large sales of alcohol in our community. The other thing was around smoking. That if you smoke, you won't get COVID. And so all of a sudden we saw this whole increase around tobacco sales. And so we looked at it and said, okay, look, drinking, you're being targeted for death, but we definitely know in tobacco, you're being targeted for death. And so we wanted people to choose life and understand that tobacco won't kill COVID, but it will kill you. And so, for our community, which were, get their information in various, settings, either from people at the bar, people at the club, people at work. But then we had all of these essential workers, people who worked at grocery stores, at restaurants, who were getting sick. And, we had folks who were dying, and people were being very silent because they felt like getting COVID was an embarrassment. Like, if we got COVID and somebody died, I don't want anybody to know, because then will anybody come around my family? Or will they want to come around me? And so we kind of treated it like the plague instead of actually addressing what was going on with COVID head on. And it was, people were dying. And so we saw African Americans who were 2.9 times more likely to get COVID, and 1.9 times more likely to die from COVID. So 2 times more likely to die from COVID. For me personally, I stopped counting at 65 friends, and these are people who graduated from high school either the year before me. 1985, I came out in 1986, so they died in 1980. They came out in 1985, 86, 87, all gone. So just imagine if you're in a room and 65 people just walk out. And so we were not, and still are not, being as vocal as we should be about the outcry around access, accessibility, around testing, around vaccinations, around food insecurity, around all of those things that make COVID such a disparity in our communities. Because it's not just COVID, it's all of the other issues that exist that make COVID so much harder on African Americans. You're on public transportation, so luckily, RTA said you're gonna wear a mask on these buses. Because people didn't have that choice. Or at work, for workplaces to say you need to wear a mask here. But remember, all workplaces weren't being compliant.
Right.
So we had people who were working at factories, long hours, with other people. People were coming in sick, giving it to their coworkers taking it home, giving it to their families, and people just dying. And so we still have people. We have 400 people every single day in the United States that die from COVID. And so when you look at it, the number of people that are still dying is still relatively high to lose that many people. And so COVID is still a problem for us to deal with. And in our community, because the misinformation and disinformation is so prevalent, we're going to have to keep pushing the message around masking up, backing up, washing up, and rolling up your sleeves to take a vaccination.
I agree. And I agree with you as well. One is too many. One death is just too many. And when it comes to vaccination hesitation, sometimes families get vaccinated after someone passes away. And that is just, why does it take that? It's just so sad.
But even then, even when they do it in secret.
Yeah.
They don't want other people to know that they have been vaccinated, because this whole misnomer about you're going to grow another head, some ears, some fingers, you're going to live, but the likelihood of you getting COVID and living is extremely high. So your opportunities for you, if you get vaccinated, is life. The other side is that you can die. And so we have to be very real when we're talking to people about why it's important for them to get a vaccination, for their children to be vaccinated, because your children are vaccinated to protect you, protect grandma, to protect your aunts and uncles or vulnerable family members and community members, their teachers, their administrators, the janitors, like all of the people that you come in contact. When you're vaccinated, you're able to help to save somebody's life. And I think that that's how we have to start looking at it. We have to become our brother's keeper. If we are not our brother's keeper, then nobody else can keep us.
Yes. Thank you. I needed that. Message. We needed that message. That segues us into, how has COVID impacted you personally and or your family? Well, you kind of told us your friends too. So
in February of 2021, after we had been doing all of the deliveries of food and I had come in contact with COVID, hadn't got COVID. One of my uncles went to visit his friend. He brought COVID home to my grandmother, who at the time was 89 years old, 2 weeks shy of her 90th birthday. Brought it home to her, his daughter, his daughter's husband, who's diabetic, his younger daughter who was pregnant, his grandbaby who was 1, my other uncle who at the time was 66, 67, and me. And what happened was my uncle who was 66 lost his arm because of COVID. You know, COVID causes blood clots all over your body. And so what we see is we see them losing fingers, we see them losing toes. He lost his arm. You know, one day he said, you know, my arm is hurting, you know, I don't know what's going on. The next day his arm was kind of white, and I said, you know, you really need to go to the doctor. He wouldn't go, you know, because of the fear.
Literally the color,
like white, and he's my complexion. And then the next day it was black, and it was gone. It was gone, and so he is an amputee now. And so my other niece, COVID also causes bowel obstruction. She had to have emergency surgery. For me, I had extreme hair loss. Like these are my locks, and they came out by the handfuls on the side. And so completely bald on the sides of my hair. My grandmother also lost her hair. Memory loss for me, brain fog, very important. I'm still a long hauler every day. I get extremely cold for hours. I feel like I'm sitting in a refrigerator, and if you actually touch me, I feel like I'm sitting in a refrigerator. And just the whole thing around trying to remember basic words. You remember, I'm a person who uses my voice for my work. So I'm sitting there with my phone playing puzzles, trying to get my words back. You know, understanding that for COVID, and then, you know, telling people now, look, anything you give to me, it has to be on a calendar. Like, you know, that it has to show up, because otherwise I'll forget. Like, you'll go, oh, well, how could you forget? I just told you. And I'm like, you just don't understand. You can tell me this now, and 2 minutes later, I'm like, okay, they told me about something. They told me this address. Let me look it up in my phone and see if I can find it. So my cell phone has been a lifesaver, helping me to be able to get my language back. And so just imagine, I'm the person who's known for my voice, and all of a sudden, you know, voice is gone. Impacted, you know, my whole family, you know. And so just understanding, my grandmother lived. My grandmother got COVID, and like most people who get COVID, most African Americans are dehydrated, severely dehydrated when they go into the hospital settings. That's why I encourage people to make sure that they're drinking as much liquids as they possibly can. That has been a big part, because being dehydrated causes your system to go into system organ failure faster. And so my grandmother, you know, we were doing lung exercises and deep breathing exercise and everything that we could do, keeping her hydrated. So when she went in, it was because we listened to her lungs one morning and said, okay, let's get you in now. So we got her in, and when the ambulance came to get her, you know, so you say, you know, you have a woman that's 89 years old, so they expected to come to the house, and she was in full distress. They came in, and she was talking to them, and they're like, well, where's the patient? This is the patient. And they're like, okay, but she's talking to us, like, very clearly, and she is not labored breathing. So she only had to take a little bit of oxygen. But the brain fog, the hair loss, those are things that she's still experiencing. Her hair has not come back. The brain fog, getting the words back, remembering stuff. And I remember the hardest part for me is when she couldn't remember me. And I was like, Grandma, don't forget me. I'm the oldest too. So, you know, I'm already a brat. So I'm like, don't forget me. And she said, I won't forget you. And then one day, she was introducing me to her aide after she came home. And so the aide was standing there, and she said, I want to introduce you to my big sister. And I said, no, she want to introduce you to her oldest granddaughter. And the aide just looked at her and smiled. And I said, Grandma, you can't forget me. And she said, I ain't going to forget you. And I said, okay, we're going to make sure that you don't forget me. You can forget everybody else. You just can't forget me. And so just understanding, you know, that it wasn't dementia. It wasn't Alzheimer's. It's COVID. And just that impact of, you know, just think about the long-term impacts. This is over a year later, almost 2 years later, and she's still having a problem with her memory. But my grandmother will be 92 years old in February, and it's not dementia, and it's not Alzheimer's. It's COVID. So just think about young people, particularly young people who had COVID when they were small. what if they had brain fog and now they can't remember mathematics? They can't remember words. But we haven't done any studies on them to determine is it a direct result of COVID? Because we don't know the whole impact of COVID. And that's the scary part.
That is scary, because the long haul, this COVID long hauler term just came out of the clear blue. We, just like COVID, we named it all of a sudden. We were sick and then it got a name,
Well, because it wasn't going away.
Yeah, it
we
wasn't
had people
going.
where it was lasting a week, a month.
Mm-hmm.
I'm with a long haul study, and I mean, we have people who have been long haulers since the very beginning. They got COVID early on, and they, still have those. But for me, I understand about me and COVID and long haul. But what we don't understand enough about long haul for children, how is it going to impact them educationally?
Yes.
If children can't remember the words, and then we're blaming them for not remembering the words and not understanding that COVID is a large part of them remembering the words. Remember, I'm sitting here with my phone trying to figure out words and working through processes. Children don't work like that, because if they haven't learned the process, how can you work through something you haven't learned yet? And so if you're learning your alphabet or just started learning your alphabet, and then all of a sudden your mom is saying, that's an A, like you knew that yesterday. Why do you not know it today? So we really need to do everything we can to make sure that we are getting our families vaccinated. That, for me, that is the important part of this. And for this conversation and all conversations that I have, because we don't know what tomorrow brings about COVID. We don't know what today brings about COVID. It might be something else that comes on. We found out, a couple months ago that pulse ox machines don't work on brown skin. We were using pulse ox machines because we're like, hey, they said go check your pulse, and if your pulse is 80, and if it drops, then you need to go get checked. Well, pulse ox doesn't read melanin, like brown skin. The browner your skin is, the less likely it is for it to work. And those are the studies that have been coming out. And so just think about, that and the whole impact around go get a pulse ox machine, which is something that was cheap and people were buying them. And they said, as long as I'm here, I'm good. And now you find out they won.
And I think about the depression behind someone that can be misunderstood of having brain fog that was, like in your instance, the voice, and not being able to do their everyday function or their job. It was a nurse that had to quit their job in the healthcare field because of, she's a COVID long hauler, and she had to step away because she just couldn't function in that capacity anymore. And someone on the other end not being able to understand that has to be even more frustrating, before it even was a thing to even understand.
Look, that's why this journey has been real. It has been eye-opening. And for me, everything that I know, I want other people to know.
Yes.
So I actually take the time and, like whatever I wanted to say today, I had to practice it because I had to try to remember it. And so this is eye-opening for all of us. And so I think that if we're going into this next stage with our eyes wide open, which we should, our eyes wide open should be wherever there are vaccination clinics available, we need to make sure that we're getting there.
Absolutely. I agree. So you pretty much explained these symptoms. Were there some symptoms that you had initially and some symptoms that you still struggle with, like the brain fog? Was that immediate, and still, what was some of the symptoms that you had at first?
So let me tell you a little bit about my diagnosis with COVID. So when I was diagnosed with COVID, I have thyroid disease, and so because I have thyroid disease and I'm obese, Even though I think I've lost 50 pounds in these last 6-8 months because COVID caused me not to be able to eat.
Yeah.
But I think for me, it was the pain. Like the morning that I knew I had COVID is when I went to get out of bed, and I was in so much pain. My legs were hurting. My joints were hurting. Like, it literally felt like somebody had just taken a baseball bat and just hit me in the knees. And I'm like, what the heck? And as soon as I got ready to stand up, I said, I got COVID. I know I got it. And so my breathing started to be labored. So when I talked to, I'm a researcher, and I talked to my other research friends across the country, and they said, this is a drug that hasn't been marketed in your community. That's been marketed for rural America, but you're going to go to the hospital and you're going to tell them you want this drug immediately. And so I got up, told my brother, I need you to take me to the hospital. And it was cold. Like I said, it was February. We got the windows down because I'm like, I don't want him to get it. We got the windows down in the car, and I'm driving. I'm in the back and he's driving in the front. And I got all the windows down because I'm like, I'm trying to keep my younger brother safe. And so we get there, and they do a pulse ox, and they say, okay, well, everything looks fine. I'm like, well, everything ain't fine. We get back into the room, and they put a machine on me, and the lady says, are you okay? Because according to this machine, according to your vitals, like, you're in distress. And I said, I know, I can't breathe. And she said, yeah, but nothing about how you appeared would tell us that you couldn't breathe.
Wow.
Right? And so remember the pulse ox thing. So I said, I want this drug. And so the doctor said, he looked at the thing. I said, I want belantamab. And he said, oh, well, you can't get it, But there had been an African, so, there's always angels that are watching. So there had been an African-American woman that walked past the room. When she walked past, she said, you look like somebody I know named Yvonka Hall. And I said, yeah, I'm her, but I had a mask on. And so the doctor came walking out the room. And I guess she was standing close enough to hear him say, we're not going to give you the medicine. And when she got out into the hallway, he got in the hallway, she told him, I think you better give her what she asked for before the news is here. For real. And that's how I got the drug.
Wow.
That is ridiculous.
That's ridiculous.
That should not have happened.
Yeah.
But that drug was marketed to rural America. It was not marketed to urban America. And it took away the COVID symptoms almost instantaneously. It was an hour-long infusion. The next day, I wasn't in pain, but remember COVID, I already had COVID. So, the brain fog and the other things were there. So even though the joint muscle aches went, I still had the cold, where I was cold, but I was sick, still sick. And I say that because I went straight to Facebook and started documenting, what was going on with me every single day. COVID day 1, COVID day 2, COVID day 3.
Wow.
Every single day for over 300 days. I would say, these are the things that are going on with me right now. This is what's going on with my grandmother. This is what's going on with my uncle. And because I wanted people to actually hear it and know you need to go and you need to, like, as soon as the vaccination was available for me, I went and got vaccinated because the vaccination became available during the time when I was sick, but I couldn't get vaccinated yet. But as soon as it became available, we all got vaccinated. And, and so I talked to some of the people that I knew, and they said, well, because of you, I went and got the same drug. And because of you, I went and got vaccinated. And because of you, my children went and got vaccinated. They did not believe it until we showed them your post talking about what COVID had done to them, had done to you, and had done to your family. So for me, having those long haul symptoms, having the brain fog, the still being cold, all of those things, for me was very impactful and still is. But it didn't stop me from doing the work because my ultimate goal is to make sure that I'm changing the lives of the community. And I can't change the lives of the community if I only sat there and said, why me? I'm like, why not me? Maybe this was for me to be an example and say to other people, this is why we need testing in our area. This is why we need vaccinations. And as soon as I'm able to do a vaccination clinic, I'm going to do them. And we've been doing vaccination clinics since November of last year.
Okay.
Yeah.
Wow. You've answered a lot of this support group that I'm hearing about, the long haulers. Is that with the hospitals, or do they have it outside, or is this something? Sometimes I just follow the media to see. It's like literally over the last month, this has just become more and more.
This is something we created.
A secret.
This is something we created. So we created the COVID support group, and it wasn't just for long haulers.
Oh, okay.
It's for people who have had COVID, people who are long haulers, and people who had loss.
Okay.
So because we wanted to have a way where people could tell their stories. Like we it's so important for people to be able to share what happened to them, because we know an important part of grief recovery is for you to talk about what happened.
Yes.
And then how do you move past this? Because remember that losing somebody is traumatic enough, but losing somebody that you can't memorialize because you couldn't have funerals. Losing somebody where you couldn't go give them a kiss, you couldn't go give them a hug, you couldn't be in the hospital with folks, and then they're calling you on the phone and saying you dropped your son off an hour ago and your son is now deceased, or you dropped your mother off and your mother is now deceased. And so we have so many people who are still in pain. They're still in pain because of not only what happened to them, but we have people who feel guilt because they did not believe in COVID and carried it home to their loved ones, and their loved ones died, or it impacted them in a whole nother way. And so the support group, we started the support group. So if I had COVID in February, so March 2021. So we was rolling before they had any support groups before they was even nationally talking about long hauler support groups.
Wow.
So, we do what must be done for the community, because my ultimate goal is to make sure the community gets the things that they need in order for them to live. That is part of our working to educate, advocate for, and empower the community. You can't empower folks if you don't want to tell them the truth. And the truth is, these are the things that can happen to you with COVID, and these are some of the ways that we can help you. And support is a big part of it. I'm telling you, we have, we look at, the underlying cause around violence, and, we don't always get to the issues. And so we talked about these children being orphaned because of COVID. How many of them are living on the streets? How many people lost their breadwinners, caregivers? The whole income in your house is disrupted because the person that was going to work every day is now gone, or the person who their pension or benefits helped keep the house going. Those things are now gone. We have to really think about how COVID impacts us, our education, our employment systems, our housing systems, and our health and healthcare, which are the main pieces of the Northeast Ohio Black Health Coalition. COVID doesn't just impact you. Like me getting COVID just didn't impact me. It impacted everybody that was around. Otherwise, I wouldn't have told my brother, we got to let these windows down in this car. I'm in a mask, he in a mask, we got windows down, because I don't want you to get this. Like, I need to get to the hospital, but I don't want you to get this. And so, COVID, I'm hoping, made us think about the larger society instead of ourselves. And I would hope that we don't go back to the selfishness that we were prior to, but I just see it because it has become so embedded in our community that it's easy for us to go back to not thinking about other people and other people's health and wellness. And if we truly believe in, going back to being our brother's keeper, then we're going to do everything that we can to make sure that we don't pass COVID on to somebody else.
That's true. And one thing that you said, going back to the grief part, some have to understand that grief is also living grief, that losing normalcy, things that we're used to doing before COVID even existed. Again, that young lady that can't do her job anymore, burnout in the healthcare or any essential worker.
The number of people that aren't our teachers anymore. They
Yes.
said, I'm good. I'm not going back to this. Health workers, restaurants.
Yes.
Look how many, like we had this whole thing like businesses, all these businesses are hiring because because people too lazy and don't want to work. No, it has nothing to do with it. You have to think about, particularly like restaurants, the people who were working there in the morning were seniors.
Yeah.
What is their risk factor for COVID? Very high. How many of them died? A lot. So how many went back to work the next day? Can't go back to work if you're dead. So we lost all of these people who are essential to these markets. And now we look at the markets and we're like, all of these places are hiring. What's going on? What's going on is COVID is going on. We have so many people that are still long haulers. We have lost so many people in our communities. We have families that are still being protective. Like, you're not leaving this house. Where their teenagers are saying, I want to go work. And you're like, no. You're not bringing that here.
Right.
And so we have to remember what the responses are in times of pain and in times of trauma. And for our community, we are traumatized and in pain around COVID every single day. Like, there is no facet of our lives that COVID has not touched. We see it, every single day when they talk about supply chain. Well, they couldn't get stuff to you because people were sick. Markets had to close. Because the workers that were working in these places were getting ill and they were dying, or they were going home and they weren't coming back. And so now production. And so now what happens? When we first started doing our food program, we know that peanut butter is a staple for poor people. You can feed a child a peanut butter and jelly sandwich and they stay full. And so peanut butter was $3.99 for natural peanut butter for a jar when we first started doing it in March 2020. That same jar of peanut butter now is $8. So,
you're talking about the big jar. I'm like, well, which peanut butter?
The peanut butter, the jar big, like this was $3.99 when we first started.
Yes.
It's $8 for that jar. Those are the things. Those are the staples that poor people use in order for them to make it over, and in order for them to get by. And so we still have people who are suffering. So the suffering has not stopped. The bleed has not stopped. So we cannot stop in our efforts to address COVID and the impact of COVID. We have to make sure that we're still being vigilant. And that's one of the reasons why we do a COVID clinic. At our COVID clinic, you will notice that it's different than any COVID clinic that you've ever been to. We provide food. At every single clinic, we provide food for attendees. So when you come in, you get food, you get a bottle of water. Those things are important to me because I don't want people to have to worry about, how am I going to go get some food after I leave here? We're going to provide you with it. We had an Autumn Fest. We did it outside. It was nice enough for us to say, let's get some people over here. Let's get them vaccinated. Let's get food trucks. And not only get food trucks, but we did healthy food in our food trucks, and it was free. All you had to do was walk over to the truck, get your order, and, you can walk away. We had apple cider, cocoa, and water. What I tried to do.
And other healthcare screenings too.
And 39 agencies and all types of healthcare screenings. But what I tried to do was create an opportunity for people to have some normalcy in their lives. Our lives have been totally interrupted. Before COVID, I was in California when COVID hit. And I think I had COVID before we knew what COVID was. And I was, I knew that I was scheduled to do some stuff in England. I was supposed to go back to Africa. Like, I had all this stuff that was planned. And all of a sudden, everybody's plans, you couldn't go anywhere, you couldn't do anything. And so I understand that people want to be normal, but let's just take the time and get through this. There's some things I'm doing this year that I wouldn't have done, but I'm doing them solo. Because for me, I'm still very fearful about being around groups and being around crowds. So I get a chance to go to Hawaii, and I just want to sit and just chill.
Meditate.
Like I've been so busy with loss, with my own health issues, with family health issues, with trying to get things out to the community, with looking at community needs, that I'm like, okay, now's the time for me to do a little bit of an exhale and try to do something for myself, because we know that we're in this for the long haul, and if we're going to be in it for the long haul, we can't just say, oh, I'm throwing up my hands, I'm not wearing a mask anymore, I'm not doing, I see people, the number of people that I see out that don't have on masks and aren't following any other types of standards, where they're like, I was at the grocery store the other day, which is traumatizing for me. That was like the most traumatizing thing after COVID, was to go to the grocery store, because I knew that in our community at the time, I think only 20% of African Americans were vaccinated. It's a little higher now, but so at the grocery store, most grocery stores have 100 people in them at a time. So that means if only 20 people are vaccinated out of 100, that means 80 people aren't. And so now you're in the grocery store with all these people, and people want to come all the way up on you. Because remember, they moved those lines. At first it was like, stay 6 feet.
Oh, yeah.
And then as soon as they said you didn't have to do it, and all of a sudden people are like right behind you. And I'm like, why are you right behind me? Like, move.
I use my cart. Like, this is going to be my distance. You going to get behind. I'm going to use this cart as my social distance.
And so people started using their carts.
Yeah.
Like, okay, well, is that my way to... And so the other day, it happened
so
again.
Scary.
I'm in the store, putting my stuff on the conveyor belt. I'm standing there to pay for my stuff. I'm standing right beside the machine, and I could feel the guy standing right beside me. Like, that's how close he was for me. And I looked over, and I had my mask on, and I looked over, and I'm like, dude, move.
Excuse
me. Why are you right here? And I just think that it's, we can let, other folks tell us that this is over. Like, we got business folks that say, oh, everything's open. Businesses are open. COVID has been cured. It's over. But it's not.
Yeah.
It's not. Our communities, we talk about, other communities getting a cold, and, African Americans getting the flu, getting pneumonia, for us. And so we're still at the stage of recovering from pneumonia. We're not fully recovered. And so we still need to pretend like we got pneumonia, and so don't let the wider community tell you that you good, because you're not. And we just have to make sure that we're vigilant for ourselves and for our kids, because we got a bunch of kids that are in schools that are not vaccinated.
Yeah.
They are not vaccinated. We had a number of administrators for schools that died, and, for us, it's making sure that we're doing something out in the community. So like this Saturday, we have our Vax Up Against COVID vaccination clinic, which is a standalone. We just pop them up. It's on 139th and Harvard, in what used to be right beside the old Jameson School, in which is now Gowan Park. So Gowan Park is there. So we'll have that. We have the food truck that's coming back. I asked vendors if they wanted to come, that they could come. I don't have a bounce house this time. I don't have a DJ, but we do have food. We do have the vaccination clinic for people who are doing their first vaccination. They have an opportunity to get $100. If they're doing the booster or a second vaccination, they get $50. This is not an incentive for you to be vaccinated. This is something where if you need some juice, if you need some food, if you need something else after this, if you need a winter coat, for you to be able to buy some of the necessities that you need. So I'm not paying people for vaccinations. I'm paying them for them to be able, I'm giving them a stipend for them to buy the things that they need. And so because they've taken time out of their busy schedules to come over and to get vaccinated. And so we're going to make sure that we compensate you, and that you can use it in whatever way you want to. So if you want to buy coats for your kids, if you want to buy Christmas stuff, if you want to buy your Thanksgiving dinner, that is your way to do it. And so I think that we need to explain that too, because we get, we get the pushback about like, why are you giving people money for vaccinations? It's like, no, we're not giving them money around vaccinations. We're giving them dollars in order for them to be able to use those dollars for the time that they've spent here waiting for their vaccinations. So we're compensating people for their time. So we're paying them like they came to work, because, vaccination clinics are busy. And so, they don't happen in 5 minutes. Like, you don't walk over in 5 minutes, you're done. So, so you're going to get compensated for your time. Time is $15 an hour. So if you got to be here for 3 hours, then you're getting $45. So
it's a good way. I like that. And what time is the clinic being held?
We're going to be there from 11 to 2, and
11
it's
to 2.
the Ohio Department of Health is going to be bringing in their matrix clinics, which is a van that they're going to be doing the vaccination clinics. But the Northeast Ohio Black Health Coalition is going to take the lead on some of the other things, because the compensation that people are getting is coming out of our coffers. So it's coming from the money that the Northeast Ohio Black Health Coalition has been raising from doing community events.
Okay.
Yeah.
And you do have a Facebook page. Is it your initials of your organization?
Yeah, so it's facebook.com/NEOBHC, Neo Black. And so we are the Northeast Ohio Black Health Coalition. You can look us up and know when we're going to be doing things. And, hopefully, for me, get vaccinated, do that is priority number one for all of us, is to make sure that young and old are vaccinated, and we're going to make sure that it's accessible to you.
Thank you so much. I had this guide here and I didn't even need it because you covered it all and then some. Is there anything else that I forgot, you forgot? I think you wrapped it up.
I just tell people, don't be so hard on themselves. I think that that we're all going through something. For you to give people, like, don't take everything personally. Everything is an argument. Don't take everything personal. It's not about you. We have so many people that are going through so many things. And just take it easy and just know that we're going to get through this. We're going to get through this together. And that we have to get through this and we have to work together, because unless we work together, we're not going to get through this. And that together part is making sure that you're vaccinated and making sure that the people in your house are vaccinated. And if you don't have, if you have elderly members of your home who are not vaccinated, and they are wheelchair bound or unable to get to sites, they do have, ways that they can call. You can call the county, and then they'll send people out to their homes for them to get vaccinated, because most of the time our elderly community members live with younger community members. So you're out partying and grandma ain't. And so whatever you're doing, you bringing it home to her. And so we want to make sure that that they know that they can get the vaccinations for their senior members of their household or disabled members of their households also.
That's true. I came in here and you just having this conversation. These conversations are so important because I've gained so much by just conversating with you today. And just, my takeaway is to take care of ourselves because of what we do and the work that we do. So I'm so grateful that you're going to take time for yourself and to continue to be patient as you continue to heal and recover with, COVID long haul syndrome. And I look forward to hearing and seeing pictures of your trip to Hawaii with your lei and flowering your hair. But I thank you so much for taking your time today out of your busy schedule. And I hope you're going to take a long time in Hawaii, like a week or two. But me personally, being in the healthcare field before doing this position and being burnt out in healthcare and changing my career to work in the community has been life-changing. And having lost to COVID in my family has given me purpose. But even talking to someone like you, I teared up a few times. I'm like, they didn't tell me I needed tissue. I knew I was going to tear up, but I feel your passion and purpose. So I thank you. This was definitely more than a podcast for me. So thank you.
Oh, thank you. Thank you so much for having me, and thank you for having the Northeast Ohio Black Health Coalition.
Absolutely. All right. This concludes our Let's Talk About Vaccines podcast with Yvonka Hall. Stay tuned for more to come in 2023 with Cleveland Motab. Thank you.